my name is Sarah Taylor, and today I want to talk about a much more serious topic, and that is the topic of suicide. So, suicide has been an issue for thousands of years. According to the Encyclopedia Britannica, some societies condoned suicide, while other societies condemned it. And most major religious groups condemn it, such as Islam, Judaism, Christianity. But examples of suicide can be seen all throughout history. Suicide has become an increasing problem over the past several years. The Indian Journal of Psychiatry found that there is evidence that with increased social media use among minors, there's greater depression and suicidality. Central Journal reports that there's increased risk of suicide for those who are abusing substances, but the cause of this increase in suicide is still being uncovered. The article Suicide Prevention and Psychology, A Call to Action, outlines two different ways that we are preventing suicide. Firstly, there's primary prevention, and those are things like workshops. And then there is secondary prevention, which is done for those who are at high risk. And this includes assessments and treatments and counseling or whatever is appropriate for them. Suicide is a complicated issue for a lot of reasons. Most obviously, it's very emotional and it's very heavy. And there's also a lot of stigma around mental illness. And like I said earlier, many religions condemn suicide, and religion further complicates the topic of suicide. Religion and personal beliefs complicate the ethics of suicide because, of course, it condemns all suicide, and that includes cases of assisted suicide. The emotional aspect and stigma further influences society's overall opinion about the ethicality of suicide. It really depends on who you ask. Personally, I take a more consequentialist approach to looking at suicide, and Kevin P. Quinn writes that consequentialism is a label that is affixed to theories holding that actions are right or wrong according to the balance of their good and bad consequences. And as we know, suicide has massive negative consequences on the victim's family and friends, and losing a loved one can be one of the worst pains that you could experience. But in some cases, I believe that suicide can be ethical, and I'm speaking about assisted suicide, and this would be a case where the patient is terminally ill and they're in great suffering and they wish to end that suffering a little bit earlier. And I think that is ethical, and it falls within this framework because it is reducing suffering. But consequentialism has some limitations. Good and bad consequences, that's subjective. What's good to me may not be good to another individual, and vice versa. So I found some people to interview who know more about the topic, so I'm just gonna show you what their opinions are. Okay, so I am currently speaking with Julie, who is a psychiatric nurse. Hi, Julie.
Hello.
I have two questions for you. Firstly, I want to ask you, in your opinion, why do you think that the suicide rate has been increasing in the past 10 years or so?
Well, I think that lately there has been a disconnect in society. If you look over the past 10 years with the rise of computers in the homes, people being on cell phones, using iPads, things like that, they're interacting, but there's not the personal face-to-face interactions that people used to have. And I think this has been a big change over the past 15 to 20 years that we've seen in our society. And as I said, I think people are getting disconnected emotionally from each other because of this.
Right. Okay, so I am currently speaking with Janet, who is a psychiatric nurse. Hi, Janet.
Hi.
First question is, how does stigma around mental illness impact patients who may be suicidal?
I think it increases the risk a lot of suicide because people are afraid to speak up and say what's on their mind and say how they're feeling. And then sometimes when they do say how they're feeling, they can get negative feedback from that, like get over it or something along those lines. So I think increases it a lot.
Chrissy, who is a psychiatric nurse. Hi, Chrissy.
Hello, Sarah.
So, in your opinion, are schools and workplaces doing enough to prevent suicide?
I think that it's improved, is certainly more so today than probably, let's say, even 5 years ago. Working in this area, I think people have, number one, been very careful to, if someone committed suicide, they were very, very unsure of how to approach a family member, much less discuss feelings that lead up to suicidal thoughts and ideas. Nowadays, I think we are seeing more about it simply because really it has more to do with, I think, the number of actors and movie stars and singers that are killing themselves. I think that's bringing a lot more forward, and I think people are starting to have the conversation now.
Right.
It's better. But it's do we have a big, long road to go? Absolutely.
I am currently speaking with Catherine Taylor, who is also my mom and a former psych nurse. So, Mom, I have 2 questions for you. Firstly, in your opinion, do you believe that suicide can ever be ethical?
I believe that if someone is terminally ill and no chance of recovery and in immense pain, that they should have self-determination and autonomy to make that decision for themselves.
Okay. And what is one thing that you would want a suicidal individual to know?
That there are other people who feel and know exactly how they feel in the world and feel exactly like they do at that moment, and there's always help, and there's always help.
All right. Thank you, Mom.
Thank you, baby.
Bye. Okay, so I am about to head out to a teen suicide prevention program. There are going to be guest speakers and numerous other things. I don't know if I'm going to be able to film, but I can be a little sneaky and maybe I'll get some good audio.
Levels, basic skills like feelings identification, how to manage emotions. We're not teaching those things as a regular curriculum in a lot of schools. Some are doing a great job, but it's not something that's universal. And I think that those are skills that ultimately that's when you can learn skills to cope with a situation that feels unbearable and painful. If you can teach those skills at a very young age, I think that we can really help with that.
There can also be a form for that as well.
And actually, there's a lot of research on the LGBTQ population that says that for them, social media may actually have like more positive benefits because it does provide this area for support where maybe they don't have a family they can go home to and talk to and they feel really, really stuck, but they haven't. How did it go from you just thinking about suicide to actually attempting and actually acting on it? And what we found for these 20 teens is that 75% of them were in under 10 minutes.
Increase the access to safe storage of lethal means. That means allowing families who are recognizing that their loved ones or friends are in suicidal crisis and to really ask questions, what lethal means do they have access to?
There is no one way to approach large issues such as suicide. We need to use multiple different prevention techniques. And when implementing these techniques, we need to consider patient privacy. There is a strong stigma towards suicidal individuals, so we want to make sure that that person's privacy is being protected. From here, we need to focus on effective suicide prevention methods. The article, Suicide Prevention Strategies Revisited, 10-Year Systematic Review, identified the most effective methods. These methods are psychological treatment, school-based awareness programs, medication, and reducing access to lethal means. So that could mean putting up a net where people commonly jump to commit suicide. So what we need to do is continue with what we know is effective while still spreading awareness to help reduce the suicide rate. Thank you for listening to my video. I hope you all have a great day.